I will be demonstrating the skill of dependent preventative positioning in a hospital bed and comfort positioning on a wedge for treatment. A patient will not be placed prone in a hospital bed for prolonged periods of time. That's why this position is used for treatment. Goals of this skill include patient comfort. Another goal is to maintain or improve cardiovascular and pulmonary health of the patient. You want to protect peripheral nerves from being impinged, and you also want to protect the integumentary system by preventing pressure ulcer development. The patient's position should be changed every 2 hours at minimum. This may need to occur more frequently if the patient has vascular insufficiency, easily damaged peripheral nerves, pulmonary problems, or decreased sensation. Check bony prominences about 5 to 10 minutes after you get the patient into a new position to check their integrity. Hi, I'm Sam. I'm going to be your student PT. I'm going to place some pillows around you to get you into a comfortable position. Does that sound all right? Yep. Great. In the supine position, the patient should be lying on his or her back with shoulders in line with the hips, and the spine should be straight. First, have a pillow beneath the head for cervical spine comfort. Next, you can place a pillow beneath the patient's knees. Just relax. Good there? This decreases lumbar lordosis and decreases the pressure on the back. You want to make sure that you don't leave the patient in this position for too long, as it can lead to decreased range of motion in knee and hip extension. To decrease pressure on the patient's heels and to decrease some of the knee flexion caused by the first pillow, you can place an additional pillow underneath of the patient's legs. Good there. In this position, pressure ulcers may develop at the occiput, the scapula, the olecranon, the sacrum, the coccyx, and the calcaneus. In this sideline position, you should have a pillow underneath of the patient's head at all times for comfort. Additionally, you should place a pillow posterior to the patient's trunk so that they do not roll backwards. When the patient's trunk is rotated anteriorly, the lower upper extremity should be flexed at the shoulder about 90 degrees so that it clears the trunk and does not put pressure on the humerus. Additionally, you should place a pillow underneath of the upper extremity for comfort. I'm just going to lift up your arm here and place this underneath. Are you good there? Yep. Good. In this position, the patient's lower extremity should be relatively extended, while the upper lower extremity should be relatively flexed, and have a pillow underneath of the knee for comfort, and to make sure that the upper lower extremity is not an amount of any adduction. I'm just going to lift you right here. I'm going to place a pillow underneath of your knee. Any pain? Nope. Good. Just going to extend this leg a little bit. Good. When the patient's trunk is rotated posteriorly, again, the lower upper extremity should be flexed at about 90 degrees of the shoulder and slightly protracted so that it clears the trunk. The upper extremity should be extended posterior to the trunk and supported by pillows for comfort. Good there? Yep. The upper lower extremity should be relatively extended and have a pillow placed beneath it for comfort and to avoid any amount of adduction. Good there? Yep. The lower extremity should be relatively flexed, and you should make sure that the upper lower extremity need not be placed on the lower extremity to avoid pressure. In the sideline position, areas prone to pressure sores are the lateral side of the skull, the lateral ear, the lateral humerus, the lateral ilium, the greater trochanter, the lateral epicondyle of the knee, and the lateral malleolus. The prone position is going to be used for treatment. The patient will be on a mat with a wedge underneath of their thorax. The patient's shoulders should be in line with their hips, and the spine should be straight. This position can be used to help stimulate cervical extension strength. It can be used to help increase hip flexor range of motion, and it can also be used to help a patient stimulate their upper extremity muscles to contract. The patient's arm should be flexed about 90 degrees at the shoulder. If the patient is able, their forearm should lay flat on the treatment mat, and the fingers should be extended flat on the mat as much as possible. For patients with low back pain, you can put a pillow underneath of the patient's stomach to decrease lumbar lordosis. I'm just going to lift you up here. And relax. Comfortable there? Yep. Good. Patients who have undergone recent heart surgery cannot endure this position since they cannot have pressure on their chest. A patient with an open undressed wound should also not be put in this position, as the wound might interact with the mat.